Every year, between 3 to 5 million people get severely ill from the flu, and up to 650,000 die from it worldwide. But here's the thing, most of us don't really understand what the flu is, how it's different from a cold, or when we should actually worry. So today, I'm breaking down everything you need to know about influenza in just 5 minutes. Let's get into it. First things first, the flu is not just a bad cold. Influenza is a respiratory virus that hits you like a truck. Here's how you know you have it. While a cold creeps up on you gradually with a runny nose and sneezing, the flu strikes suddenly. We're talking about waking up one morning and bam, you can literally pinpoint the hour you got sick. The telltale signs: a high fever between 38 to 40 degrees Celsius, severe body aches that make you feel like you've been hit by a car, crushing fatigue, a pounding headache, and a dry cough. You're not just uncomfortable, you literally cannot function. If you can still go about your day, it's probably just a cold. If you're bedridden and miserable, that's the flu. So how do you catch this thing? The flu spreads through tiny droplets when someone coughs, sneezes, or even talks. These droplets can travel up to 2 meters, that's about 6 feet. But here's what's scary, you can actually spread the flu starting one day before you even feel sick. That's right, you're contagious before you even know you have it, and you'll keep spreading it for about 5 to 7 days after symptoms start. You can also catch it by touching a contaminated surface, like a doorknob or your phone, and then touching your face. This is why hand washing is so crucial during flu season. Now, most healthy adults recover from the flu in about 1 to 2 weeks. But for some people, the flu can be deadly. Here are the warning signs you need emergency care: difficulty breathing or shortness of breath, persistent chest pain, confusion or can't wake up properly, severe vomiting that won't stop, and bluish lips or face. In children, watch for fast breathing, not drinking enough fluids, extreme irritability, or fever above 40 degrees. Certain people are at higher risk for serious complications: adults over 65, young children under 5, pregnant women, and anyone with chronic conditions like asthma, diabetes, or heart disease. If you're in one of these groups and you get flu symptoms, call your doctor immediately. Here's something crucial: timing matters with the flu. There are antiviral medications that can help, but they work best if you start them within 48 hours of getting sick. Drugs like oseltamivir, you might know it as Tamiflu, can reduce your illness by about a day and significantly lower your risk of complications. But here's what antibiotics won't do: cure your flu. The flu is a virus, not a bacteria, so antibiotics are useless unless you develop a secondary bacterial infection like pneumonia. For home care, here's what actually helps: rest. Seriously, stay home and sleep. Drink plenty of fluids, water, broth, electrolyte drinks. Take paracetamol or ibuprofen for fever and pain. Use a humidifier to help you breathe. And please, stay home until you've been fever-free for at least 24 hours without medication. Don't be that person who brings the flu to work. Okay, prevention time, and this is the most important part. The single best way to avoid the flu is to get vaccinated every year. And no, the flu shot cannot give you the flu, that's a myth. The vaccine contains dead virus particles that can't infect you. Yes, the vaccine isn't 100% effective, but even if you do get the flu after being vaccinated, your illness will typically be much milder, and you're way less likely to end up in the hospital. Other prevention strategies: wash your hands frequently for at least 20 seconds. Don't touch your face, especially your eyes, nose, and mouth. Cover your coughs and sneezes with your elbow, not your hand. Clean frequently touched surfaces. And if you're sick, stay home. So there you have it, everything you need to know about the flu in 5 minutes. The key takeaways: get your flu shot, wash your hands, stay home when you're sick, and seek medical help if you're in a high-risk group or experiencing severe symptoms. If you found this helpful, hit that like button and subscribe for more health content. Drop a comment if you have any questions, and I'll see you in the next video. Stay healthy out there.